Is it safe? What's the risk to my eyes? According to guidelines recently released by the Eye Surgery Education Council, fewer than 0.1% of patients who have received LASIK to date have experienced serious problems. Most LASIK complications can be treated and usually resolve within a few months, and incidence of less serious complications such as haze, halos, and glare is variably reported at 3% to 5% worldwide. Your risk of certain complications is very much related to your own visual system and eye health. Dr. Beyer will inform you of any special circumstances that are revealed during your comprehensive LASIK evaluation and screening that might affect your outcome. Might there be long-term complications? The most common complication from LASIK is dry eyes, but otherwise complications are extremely rare. At Beyer Laser Center, care is taken to go over the post-operative instructions several times with patients. Close attention to following all post-op instructions is the best way to reduce the risk of complications, because not following them is the #1 cause of LASIK-related issues. Dr. Beyer also insists that you are seen within 24 hours after the surgery to make sure that you're healing properly. Will it hurt? The procedure is most commonly described as mildly uncomfortable. You will be given numbing eye drops, so the only sensation you will feel during the procedure is the suction that is applied during the flap cutting procedure. Most people report no pain whatsoever upon waking up the day after surgery. How much time will I miss from work? You should plan to go home and rest for the remainder of the day after having your procedure. But after a good night's sleep, you will be ready to drive a car and return to work if you so choose. How do I choose the right surgeon? Of course, choosing a surgeon is a personal decision and should be based on a high level of comfort with the doctor and his staff. Some areas that you should investigate in order to increase or confirm your comfort with the doctor are experience, personal attention, and satisfied patients. Dr. Beyer has performed more LASIK procedures than anyone else in the city of Boulder, but his center is not operated like one of those LASIK factories you hear about on the radio. At Beyer Laser Center, every patient receives very individualized and personal care. Taking advantage of the doctor's free LASIK evaluation is the fastest and most thorough way of getting a good sense of whether this is the right doctor for you. What's really the best technology? Today, the best technology utilizes a wave scan to map your personal vision system. This highly detailed map shows aberrations that are not detectable with traditional eye examination equipment. The wave scan map is then used to program your personally designed LASIK procedure into the laser equipment that is used to perform the surgery. Why is LASIK sometimes considered safer than wearing contacts? Contact lenses reduce the amount of oxygen on the surface of the eye, which in turn reduces the blood flow to the cornea. Very often this can lead to complications such as infection. Soft contacts are better than hard contacts, but over time, both hard and soft lenses tend to lead to symptoms of chronic wear and tear on the eye. LASIK offers those with vision correction needs the chance to see naturally the way nature intended. Can I afford it? Beyer Laser Center offers a variety of plans such as 3, 6, and 12-month interest-free financing, as well as 18 to 60-month basic plans. It is also a good idea to check with your insurance provider. More companies are now offering discounts on LASIK. You may also look into using a flexible spending or cafeteria plan through your employer if they provide one. How much will it cost? There is a range of prices depending on the options your doctor recommends for your consideration. Many patients prefer the low-interest financing where your monthly payments can be as low as $71 per month for both eyes, which includes all of the tests and exams, the procedure itself, and all of your post-operative visits plus any enhancements that are performed during the first year after surgery. Why do some advertise $495 per eye and others charge $1695 per eye? Every surgeon establishes policies about how they want their practice to operate. Some are more focused on getting the highest volume of procedures possible, so they discount the fee to bring in more volume. Some practices use older or cheaper laser equipment, so their costs are less. And frankly, there are some practices that we call discount centers that advertise a very low price, which only a very small percentage of the population can even take advantage of. If you respond to one of those very low-priced ads and go in for the evaluation, you'll usually find that the cost for them to do your surgery is equal to the cost Beyer Laser Center quotes in the beginning.